So we are starting our last session of the forum, the reflections and next steps. And from this session, we're going to first hear from Naomi Goldstein. She's Deputy Assistant Secretary for Planning, Research, and Evaluation and Chief Evaluation Officer in the Administration for Children and Families, part of the U.S. Department of Health and Human Services. Previously, she directed the U.S. Postal Service Commission on a Safe and Secure Workplace, an independent commission that examined workplace violence affecting Postal Service and the nation. She served as project manager for the Urban Institute's Assessing the New Federalism Project and as executive officer in the Office of the Assistant Secretary for Planning and Evaluation at HHS. Earlier in her career, she worked in the Massachusetts state government and developed infant mortality prevention programs at Brigham and Women's Hospital in Boston. Dr. Goldstein has a PhD in public policy from Harvard University, and she was awarded the presidential rank of Distinguished Executive in 2012. Naomi?
Thank you. This was really a wonderful set of really rich, fascinating presentations, and delighted to have the opportunity to comment. So I think we all know that the evaluation enterprise is about examining what works. And also a slightly more nuanced version is what works for whom. A further dimension that we've heard about today is what works for whom in what setting. And then yet another dimension that we heard quite a bit about is what works for whom in what setting compared to what. So I think these questions, they're kind of like the 5 W's in journalism, who, what, when, where, and why, but less pithy. And for each of these dimensions, I think that the field could really benefit from more commonly accepted categories or constructs or criteria that could inform evaluation planning and execution and the reporting and interpretation of results. And these, and specifically could inform the operation of and design of systematic evidence reviews. And these common categories or constructs do exist in greater or lesser degree, depending on which dimension you're looking at, and also I would argue, depending on the programmatic or policy area that you're looking at. And that Dana mentioned some of those distinctions, and I'll get back to that in a minute. So I want to talk about, briefly, about each one of these dimensions. What do we mean when we say what in the what works? What do we mean by works? What do we mean by for whom? How do we define the setting? And briefly touch on the counterfactual, since that was covered pretty extensively today. So when we look at the what in what works, we're talking about the black box, as Janae Riley mentioned. So, and there are many dimensions, even within this dimension of the what. So we could be talking about how is the program design or model defined? How is it implemented? What is the level of maturity or site readiness? Are we looking at kind of a basic model or an adapted model or a new version of a model? And who decides what model counts as the same or different? Is it the federal funders? Is it the grantees or the on-the-ground providers? Is it the model developers who may provide various degrees of oversight for implementation? As has just been discussed in some programs, some models have a high degree of definition and manualization. Some have extensive oversight from the model developers that you're only considered to be delivering a particular service if you are meeting certain fidelity standards imposed by the model developer. These are all actually pretty complicated and subtle areas. I wanted to mention that we have recently issued in the Federal Register call for public comment on some new standards for our home visiting evidence of effectiveness review, known as HOME-V, about definitions for model versions and adaptations. And as members of the public, you're all welcome to comment. And I also wanted to mention that at the end of October, we will be sponsoring a meeting specifically looking at how to define and measure core elements of human services programs. So these are all complicated and important questions, and they do differ across programmatic areas. Both, I think, Annalisa and Dana touched on this. So I think employment and training programs may be particularly at one end of the spectrum with little manualization, fairly loosely defined interventions. And my personal view is that this is because they're rooted in the tradition of economics, where people assume that human beings are rational actors who respond to rules and costs and incentives. And so once you've said, oh, well, we're providing employment and training services, we'll just see how people respond to that. You've done it. You've defined your intervention. Whereas in early care and education, for example, which is rooted more in the tradition of psychology, it's assumed that relationships and emotions and what actually transpires between a human being who's a provider and a human being who is a toddler, that it's what transpires in that interaction that counts. Those interventions are much more likely to be carefully defined and documented and manualized. There also are differences across programmatic areas in statutory requirements. So, for example, in the maternal, infant, and early childhood home visiting program, the bulk of federal dollars are reserved for evidence-based models. And so it's very important that our home visiting systematic evidence review be organized around models. Whereas in the personal responsibility education program, which is a teen pregnancy prevention program, the statute requires funds to be used for evidence-based models of services or for services incorporating elements of evidence-based models. So that gives providers a great deal of flexibility and points more to the importance of understanding the impacts of elements of models. Okay, so that was the what. What works? I want to turn next to unpacking the works, the verb in the phrase, which is not something that we talked about a great deal today, although it was touched on. And there are a number of elements here that are complex and can bear a lot of discussion. So one is the magnitude of impacts, effect sizes. How do you interpret them? How do you define them? What adjectives to apply to them? What is considered large or small? What is considered meaningful in policy terms? And in the context of a systematic evidence review, do you or don't you want to set thresholds where an impact has to be of a certain size to count toward effectiveness? One of the speakers, and I'm sorry, I forget which one, did talk about the situation where you may have multiple outcomes, and how do you interpret findings that are mixed? What if you have favorable outcomes, favorable impacts on a couple of outcomes, and unfavorable impacts on another outcome? How do you weigh those and come up with a summary judgment about whether the program is effective? Duration of impact is another dimension that is challenging. In some of the statutory requirements for systematic evidence reviews or for evidence-based models, there are thresholds. So in the home visiting statute, it's a little convoluted, but specifically for randomized control trials that have been published for randomized control trials, but not for other types of studies, there's a requirement that impacts must last at least a year for a model to be considered effective. And in the Family First statute that extends Title IV funds to preventive services for children at risk of foster care, the top tier of effectiveness requires impacts that last for a defined duration. Okay, so that's all I wanted to say about the verb, the works in what works. So what works for whom? I think this was touched on, that, typically one might look to studies that have examined a similar population for example, to predict whether an intervention you're looking at is likely to be effective, or if you are a service provider and you want to select an intervention, you would want to look at an intervention that's been tested on a similar population. I want to suggest that defining what is a similar population, is not a simple matter. So just during this morning's sessions, I jotted down a number of dimensions that could define a population: gender, age, race, ethnicity, within ethnicity, nation of origin, immigration status, generation of immigration status, era. So almost by definition, if you are looking at past studies, you are looking at populations that are of a slightly or dramatically different generation. And particularly if you're looking at long-term outcomes, then of course, whatever they experienced in the program happened years ago. Are you looking at, for example, TANF recipients versus TANF eligibles, or similar other low-income populations that are deemed to be similar in some way? Are you, in one of the examples, the comparison was between two different populations, both characterized by having disabilities. So these considerations are important for external validity in understanding, to what groups can a study finding be generalized, but there are also a lot of interesting and complex technical questions about how to construct subgroups and interpret subgroup findings, leading to questions about multiple comparisons, about data mining or fishing for results, and different systematic evidence reviews have different decision rules about whether subgroup findings are or are not counted toward evidence of effectiveness. Okay, so what works for whom? I've covered 3 dimensions, and I'm going to move on to setting. Again, I would suggest that we want to understand setting so that we know how or far or where we can generalize findings to, but I also want to suggest that setting is complicated, and deciding which elements of setting count towards deciding whether the setting was similar or not is not an obvious question. So again, just a few different dimensions of setting. Are we looking at urban, suburban, or rural populations? Are we looking at tribal settings? Are different geographic regions of the U.S. equivalent? I know from experience that state officials tend to be most swayed by findings that occurred in their own state or nearby. Do we consider international comparisons legit? Are all developed nations equivalent for the purposes of our study or not? What about studies that have taken place in less wealthy nations or less developed nations? Do those count or not count toward understanding the effectiveness of an intervention that we want to implement in the United States? For youth programs, school versus community settings are a distinction that matters. That wouldn't matter for adult populations. For early childhood programs, are we looking at a Head Start setting, a pre-K setting, a child care center setting? And then some of the other, some things that came up today included whether we're looking at a setting that's characterized by rich community resources or scarce community resources. What is the organizational setting? What are the characteristics of the organizational or program leadership? Jarnae mentioned how the intervention fits within the larger organization, and I was kind of fascinated by the discussion about monitoring and TA as being an element of either the program itself or the setting, depending on how you want to think about it. Okay, so what works for whom, in what setting, and compared to what? So there was a lot of discussion about counterfactuals, and I'll just offer a couple of comments. Measuring the counterfactual is obviously, well, now that I've listened to this morning's conversation, I can say that it is obviously very important, but it can also be quite challenging, particularly for large or multi-site studies. So in a large study that's national in scope, I've been involved in some that have had as many as 80 sites dispersed around the country. The members of the control group may be receiving services in thousands of settings. So it's not feasible to, say, observe the services that they receive. So organizations that are not providing the treatment may have little to no connection to the study. So they have little to no incentive to fill out that survey that you sent asking them to describe the services that they provide. Okay, and I just wanted to build on something that Steve Bell mentioned, that he mentioned that the Head Start Impact Study, which was a randomized controlled trial that was national in scope with about 80 Head Start grantees participating and I think about 250 actual Head Start centers, compared Head Start with what else was available in the community. So that did create practical challenges of how to gather information on what the control group experienced. I will also mention that it was pretty controversial and that many people felt the study was asking the wrong question, as Steve suggested, that it was of less interest to know how Head Start, what were the impacts of Head Start compared to all the other types of early childhood care that kids might receive, and that it would have been more useful to know how Head Start affected kids compared with no services. But of course, as Steve mentioned, it's not possible to construct a literal no services control group in many situations. So what works for whom, in what setting, and compared to what? I think each of those dimensions has many subdimensions, and I do think that our broad field of evaluation, as well as program design, could benefit from greater common frameworks and constructs for how to break those down. And I wanted to just mention specifically how that, some thoughts related to systematic evidence reviews. So differences in systematic evidence reviews, in the decision rules and procedures that systematic evidence reviews use, are quite consequential in what those reviews find. So, and that includes differences in rules related to assessing the quality of evaluations, so what evidence is considered admissible, and also differences in decision rules regarding what those evaluations must show in terms of impact. And there, as has been mentioned, there are many federally sponsored and other systematic evidence reviews up and running, and they do differ in many ways. There are sometimes discussions about whether we ought to make ourselves be more consistent across those systematic evidence reviews. There's quite a bit of communication across those reviews. They build on each other, they borrow each other's standards, so it's not that everybody's running off in different directions. But I suspect, I don't know, that some differences will be unavoidable. So for one thing, there are different statutes. Of course, that's not necessarily a permanent thing, and if somebody wanted to try and rationalize across statutes, it might be worth a try. But some statutes provide broad definitions for what the different evidence tiers should be. As I've mentioned, some statutes mention duration of impacts. So there may be statutory reasons for differences. And then there are also differences in the state of the research. If there's a rich research base, then it may be possible and desirable to set higher standards, for example, for the quality of the studies that will be accepted as evidence, or it may be possible, for example, to require that there be findings in 2 different studies. But if there's a thin base of research, then you might want to set less stringent standards. In addition, in some of the areas covered by systematic evidence review, there are multiple outcomes of interest. So the home visiting evidence review is related to the home visiting program, which is a program that is defined by the mode of delivery. And according to the statute, there are 8 outcome areas that are to be considered. In contrast, in the teen pregnancy prevention realm, there are only a few outcomes to be considered. So the statute, the state of the research, and the nature of the policy and program environment all drive decisions and sometimes differences in systematic evidence reviews. But to return to my opening point, I do think that greater explicitness and commonality in unpacking some of these dimensions could lead to, if not more similarity across evidence reviews, at least a common language for discussing the differences. And those are all my comments, and I look forward to the rest of the discussion.
Great, thank you so much. A lot of very interesting information there in a quick 25 minutes. I think you did that in about 20 minutes. It's great. So we do have about, well, we've got a little over 20 minutes for question and answers, reflections from the group. I'd also be interested to hear whether some of our other panelists have reactions to what Naomi has just talked through. But let's start off with the one question that we have in the Q&A box right now from Ronald Wade. Listening from a summary perspective, the number of variables is extensive. How do we approach the isolation of variables in order to come to a rational conclusion?
Well, if that was a question for me, I'm willing to take it on. I agree, and that I think was part of my point, is that in each of these dimensions, what works for whom, in what setting, and compared to what, I can easily come up with a dozen different constructs that ought to be looked at, and then within each construct, no doubt there are many ways to define the construct or operationalize it or define it. And I think my hope is that over time the field will come up with templates or checklists or categorizations that will help people select which dimensions to examine. And I think systematic evidence reviews can be one useful avenue for trying to spell some of that out.
Okay.
Geez, that's daunting, Naomi. It will be huge progress if we can catalog what we're looking at in our assembled evidence to date and against those dimensions, and where the next study fills the hole. Folks like Anna and Dana can think with others about true meta-analysis on these dimensions around the measures of effectiveness and where the patterns sit, where the patterns play out of the dimensions that are the ones that may be difference makers in bigger impacts. Within, a chunk, not across all of employment and training and research in its 6 dimensions and 72 subdimensions. But in fact, I will do what Patty just did and ask Anna to give a thought about that as our, or Dana, as our people who've been in the evidence synthesis, evidence assembly trade here for a while.
Yeah, I mean, I would just say that it sure does seem like a job for meta-analysis in terms of disentangling all these different dimensions. I think, these are all certainly a lot of really interesting dimensions and important dimensions to consider. And the tool that comes to mind is a meta-analytic type of approach to try to disentangle that. I'd also say that, maybe there's scope here for more Bayesian approaches to really be used. I think of, and I'm by no means an expert on Bayesian statistical analysis, but I feel like Bayesian analysis can oftentimes help us to disentangle within an intervention more about what is working for whom, under what circumstances, and the like. So I think there can be work done here, both from systematic reviews and meta-analysis, meta-regression, and the like, as well as individually on individual studies to really parse that out and try to disentangle.
Yeah, Dana, I want to push you a little bit more on the meta-analysis observation, because I think that there really is an opportunity there. And it flags to me that any one study can't possibly provide all of the insights into those 5 elements, the what works for whom, in what settings, and compared to what. But thinking about the aggregation of them, I think one of the things that's going to be increasingly important is if we're going to learn more from meta-analyses, it's going to be through having the intervention and counterfactual conditions both well detailed in studies, so that when we're looking at a given impact or effect size from that study, we can know more about the various context elements of the intervention in order to identify what are the factors that associate with stronger or weaker impacts. And in order to do that, some of those measures are going to have to be consistent across studies. And it's quite a task, I think, to take that on, but I think there's a huge amount of promise there, and I'm excited about that.
Yeah, I mean, I think the thing about consistency that you say is really resonant. I think that a lot of what clearinghouses do, that Naomi mentioned a bit, but that often is unseen by the public, is just to code things consistently and try to bring everything into one schema. And it's, I mean, honestly, it's a struggle because if you imagine, it takes a lot of effort to get 5 authors to agree on how to describe something, let alone, pulling across 300, 400 publications, or in the case of the Pathways to Work Evidence Clearinghouse, we have 216 studies, many of which have, 2 to 10 publications associated with them. So I think that really resonates with me.
I think there's opportunities to continue this conversation, because I know that at the upcoming Research and Evaluation Conference on Self-Sufficiency that OPRE supports, I'm giving a presentation on that topic, and then the APPAM Fall Conference as well. So peruse the programs of those events for more on this, and thanks to the Westat Forum for starting the conversation.
Absolutely. Naomi, did you have any reactions to anything from Steve or the others?
Well, having sort of tossed out this idea that somebody ought to, create a common lexicon or, catalog of these dimensions and how to define them, I realized that this is a huge effort, and particularly given that when I say the field, it's a lot of fields. It's a lot of different academic fields. It's a lot of different programmatic areas. It's a lot of different federal and other funders. So I really don't know how one might get from here to there. So it's an aspirational idea. I could also take the question that Deborah Rogg put in the Q&A, since as the Fed on the panel, Deborah Rogg asked, does the new federal policy on evaluation provide a possible mechanism for getting more consistency across evaluations? I think that's a great question. So pursuant to requirements of the Evidence-Based Policymaking Act, ONB has issued standards for evaluation that all federal evaluation officers are required to comply with. I would have to go back and look at it to see to what extent it addresses these questions, but if it does, that is certainly a good hook to hang activities on, and if it doesn't, maybe it will in future iterations.
Yeah, great. And then I think the next box, the next question in the Q&A box, I think was a reaction as well to something you had mentioned, Naomi. Interesting point about employment and training coming from an economics tradition with more loosely defined service packages. What's the implication for the appropriate evaluation approaches? Does this imply a no services counterfactual? Does it make a service component analysis, the value of certain service elements, more challenging? Neil, thank you.
So I'm not sure that I can answer those specific questions, but I'll make a couple of observations that may be responsive. I think, I come my training is in public policy, which is, heavily informed by the economics paradigm. I've worked, in my professional life, I have worked with many early childhood specialists who come more from the psychology paradigm. And so the whole idea of a manualized intervention was surprising to me when I first came across it. And I initially was very, it just seemed like an awful lot of trouble. Here are the sort of economists and the employment and training folks whose attitude was, well, I've got an idea, let's implement a program and we'll study it. And then the early childhood psychologists were spending years developing and pre-testing and manualizing an intervention. And I think I've come to appreciate benefits from both approaches, and maybe there's some middle ground or maybe there is no ideal. Maybe it really is more a matter of intention and setting. But I don't mean to say that one extreme is obviously superior to the other extreme. And, particularly with programs serving adults, there are policy innovations that really are just about changing a rule, or largely about changing a rule. So, things in the welfare sphere, changing, or like the example in one of the earlier presentations about the benefits cliff. If you change that rule, what happens to people's behavior? You don't necessarily need an intensive implementation study. Although, even in a situation like that, you would want to know, for example, whether recipients were aware of how their benefits vary depending on their earnings. So even with a simple rule change, there may be implementation aspects to study. So that's not a very specific answer to the question that was posed, but just a few reflections on kind of how these different approaches and paradigms have benefits and disadvantages.
So Steve or Laura, do you have any reactions to this comment?
No, if I could, I wanted to push Naomi on a different front. The forum today was largely about strengthening the fundamentals of how we undertake impact evaluations of social programs and workforce development applications as an example, but just in general, impact evaluations of social programs using experimental designs, how we strengthen the foundations of that. And I wondered, Naomi, if we left out some topics where you think doing the next dozen of these, let's say for your office, is, could give stronger evidence wherever it's going to sit in this mega matrix of what, for whom, in what context, et cetera. Where the next dozen of these things done for your office will be better informative to policymakers if we as a profession invest in stronger approaches. Where would you like to be more powerfully equipped in these future studies than you've noticed of the studies done up till now?
Well, that's a big question. Let me mention a few things, and this really is off the top of my head, so don't take it as, I might have a different answer if you ask me tomorrow. So today's presentation touched on the question of cost, and I do think that's something that we don't always address very thoroughly. I think the counterfactual questions are really important, that, we say we want to know what works, but it's not really a coherent question if you don't know what you're comparing it to. So, continuing to explore that dimension and kind of just better define the questions that we're asking. I think certainly in my involvement with systematic evidence reviews, and I've been involved with a few, We have stayed away from establishing any thresholds for effect sizes because particularly for systematic evidence reviews where there are dollar implications, that if something is found to be evidence-based, then it's eligible for federal funding. It's very important that we have objective, transparent, codifiable rules because, trust me, people will question every decision and they have to be defensible. And we have neither wanted to establish kind of firm arbitrary cutoffs that if you have an effect size above, point X, then you're evidence-based, and if you don't, then you're not. It's difficult enough to do that on one dimension. It's even more difficult if you're, say, comparing impacts on child abuse with impacts on number of referrals to other services, something that is, hugely consequential in a kid's life compared to something that may be comparatively trivial. You'd have to establish different cutoffs for each type of outcome. And there's just a lot of judgment required. I don't know how you could do it objectively without being extremely arbitrary. So that's something that seems like it warrants further exploration. And then lastly, just one of my favorite points that I haven't gotten a chance to make yet about what's useful and what isn't. We have, in my office, has occasionally carried out evaluations of whole programs, mostly when Congress requires us to. So the Head Start Impact Study was one example. The Maternal, Infant, and Home Visiting Program Evaluation is another example. And those experiences have led me to believe that studies of looking at program enhancements are more informative to policymakers and program providers than studies of whole programs, because it turns out you can do a study of Head Start and conclude that the national average impact of Head Start as a whole compared to that big, messy counterfactual of whatever else kids get, that the average impact on, say, early literacy is X. And if you're a person who is in favor of early childhood education and the Head Start program, you will interpret that as glass half full. If you're a person who is skeptical, you will interpret that as glass half empty. And it's just not very informative to policymakers. I think it's pretty unusual that, if not, well, pretty rare that, a finding like that would actually inform whether the program is going to continue to exist or be funded. So much better to focus on evaluations that are meant to inform improvements. Can I take that last one just a little farther?
Sure.
It is surprisingly common in my experience to carefully design an evaluation and come up with results, even if it's not the common experience of the results being sort of mixed and complicated and hard to interpret. Even if the results are pretty straightforward, and let's say we find that, a 10-week version of a program is more effective than a 5-week version of a program. Those results still don't necessarily provide obvious policy answers. If you can get stronger impacts for half as many people by providing twice as intensive services, or weaker impacts for twice as many people by providing half as intensive services, you're still stuck with a policy decision about whether you want to affect more people less intensively or fewer people more intensively. I don't mean to say that those impact findings are unimportant or irrelevant, but they don't necessarily address, they don't answer the policy question.
They still leave a quandary.
And so I think my point, I think, is sometimes I think we just need to think even harder about what is the question that we want to answer and what is the question to which the answer really will be useful for policy purposes.
Thanks to all of our panelists for a really great day and a lot of things to think about, good reflections here. And thank you, all of our audience members, for your time today, willing to do this as a virtual session, and your engaging questions. And as a reminder, we will have the recording and slides that are available on the APPAM website in about a week or so. So please come back and get those materials and look for them. So on behalf of everyone, thank you very much.